begin. Good morning, everyone. So I'm Jennifer Senior from The Atlantic. I'm here to introduce our two guests, panelists. Dana Suskind is a surgeon. She is director of the Pediatric Cochlear Implant Program at the University of Chicago. And most relevantly for our purposes, she is the co-director of the TMW Center for Early Learning and Public Health. Bonnie Kerker is an epidemiologist. She is an associate professor of population health and child adolescent psychiatry at NYU Medical School. And again, most relevantly for our purposes today, she is the director of Together Growing Strong, a program that supports parents and kids in a low-resourced immigrant community in Brooklyn, which happens to be down the street from both of us. We didn't realize we were neighbors until we did this. Anyway, so good morning. I think we're going to dive right into this. And we're going to start with sort of a depressing stipulation, which is that the United States is uniquely terrible at supporting parents. I mean, it's impressive almost, our level of dereliction. And it's almost contraindicated, I would say, to what we parental and child flourishing, what we do. And Dana, in your book, Parent Nation, which is very good and which I would highly recommend, you give a devastating catalog, a kind of rap sheet of the particular ways that we are terrible at supporting parents. I mean, so let's stop making this theoretical. Let's contextualize this compared to developing nations.
I love that as a first question because I think often in this country for so long, when you think about being a parent, it's about a struggle, it's expensive, it's anxiety provoking, and I think widening the lens and realizing what an outlier we are compared to the rest of the world really gives us hope that, you know, it doesn't have to be this way. I do want to take a moment to mention sort of the perverse irony that this morning, you know, the overturning of Roe v. Wade, and that we're talking about the lack of support for families, but that's not what today is about. Although it is about, do we value our families? Do we support them? And the rap sheet. So most of the audience knows that we are literally the only country of 41 OECD countries without paid family and medical leave. You know, what does that mean? 1 in 4 mothers go back to work within 10 days to 2 weeks of giving birth. 77% of employees don't have paid family and medical leave. You know, down the rap sheet, high quality childcare. In most of the developed nations, there is support, financial support, the average being about $14,000 per year per toddler that society supports families. I mean, we're not even talking about, you know, the Scandinavian countries of $29,000 per year, but in our country we support about $500 per year per child. What does that mean?
500 versus 14,000 for the low end.
Yeah, exactly. So
it's like
and what does that mean?
Yeah.
I mean, it costs more than a mortgage or sending your child to, you know, a state college to send your child to childcare. And yet we have such low quality childcare. Only 10% of childcare in this country is high quality, and we pay childcare providers less than dog walkers. I'm going to go one more on the rap sheet because we could spend all our time on this, but child credits. You know, most of the developing world realize it's expensive to raise children. 108 countries provide child tax credit. We did for a millisecond, but we don't have it. We have incredibly high rates of child poverty, children living in low-income backgrounds. You know, 40% of our children are growing up poor. If you're brown or black, it's almost 60%. So, you know, going down the road, the rap sheet, it's pretty hard. But we have hope because we see what other countries can do. So
yes, we'll get to that, and whether they're mocking us or not. But so let's go back to something you said. All right, so this strikes me as, in some ways, distinctly American, right? That we are thrown back on our own resources, that we are going it alone. And a lot of us don't have the resources that we need, so it's pretty dire. So I'm going to ask you both, and I'll just start with you since you initially gave this recitation, this devastating kind of recapitulation. How does this show up in the community that you serve, what are you seeing specifically?
Yeah.
Given that, I mean, given that 1 in 4 women have to go back to work in 2 weeks after they've given birth and things like that, you must have a satchel of stories to tell.
No, I mean, stories are how we understand the complexity of things. I think in a nutshell, it's barrier after barrier after barrier placed in front of parents who are just trying to raise their children. And I can tell you many stories. One that comes to mind is this woman, Sabrina, that we worked with in the center through our programs, an amazing woman who was raising her 2 young children in a homeless shelter for almost 2 years. And you could say, well, why was she in a homeless shelter? The truth is that she had to give up a well-paying job to take care of her husband when he became incredibly ill. And because there was no family or medical leave, they ended up in a homeless shelter. And you could say, well, why 2 years? I mean, did it take so long to place her? And another perverse situation, because she was in a married situation, they had a hard time. It's easier to place people if you're a single parent. And they actually said, well, maybe you should fib or break up the family, which of course is not a choice that they would have. And I guess choice is the issue, that nobody really has choices. And I could tell 2 more stories, but I don't know if I'm taking up too much time. So
let's go to Bonnie and let's see, we might be able to circle back, but the perverse incentive system is also really interesting. Bonnie, you look at a very different population. Tell me, how is this manifesting in the groups that you serve?
Right, thanks, Jennifer. So I work in an immigrant community in Brooklyn, New York. It's called Sunset Park. And Sunset Park, most of the residents in the community are from China or from Latin America. It's a really hard-working community. Employment is really high, but employment is really low-paying, and there are lots of challenges that families face. So there's high levels of poverty, low levels of education. Families are in tight housing. The housing stock is really low, and because of the low income that most families have, there are families that are double and tripled up in basement apartments that are just 1 or 2 rooms. During the pandemic, the Asian community faced a lot of anti-Asian hate and discrimination. There are a lot of undocumented individuals in the community that really bring up a lot of economic challenges for them, but also fear of deportation. And that was a real fear, especially during the Trump administration, but now as well, for the entire community. And all of these things lead to stress. And they lead to really high levels of stress that we know from research is associated with poor physical and mental health outcomes for parents and children. And the stress makes it really hard to parent. I'm a parent. I'm sure many of you are parents. And I know when I get even a little bit stressed, it makes it really hard to sit down and play with my child, to engage with my child, to read to my child, to really put my space in where my child is. And so think of the multitude of stressors that families are facing in these communities, and then we ask them to just parent on their own without any support. It's really unfathomable.
So about 2 questions downstream from now, I want to get into the toxicity of stress and how that affects families. I think that's really important. Just for a second, my first question didn't really disaggregate. I just said the communities you serve, but they're probably different. So can you tell me a little bit about how the different communities' needs appear to you? Yeah.
Sure. Oftentimes we look for these scalable solutions because we feel like if we have a program that works really well in one community, that we can just plop it in other communities and then we're all set. But the reality is that communities are different. Communities have different cultures, communities have different stressors, they have different assets that are really, really important for us to understand if we really want to help and work in communities. So in Sunset Park, as an example, in the Chinese community, we have found super high levels of stress among pregnant women. About 60% of pregnant women that we've surveyed have scored at risk for postpartum depression. And one of the main stressors that they're facing is an inability to practice postpartum confinement. Postpartum confinement is a practice that Chinese families do, where after birth, a woman is confined, she's isolated, and an elder or other family members take care of her and take care of the child. And the mother learns from their relatives, from their family, how to take care of a child. Well, that's really hard if you're an immigrant in a community without your family around, particularly during the pandemic when people couldn't travel. And so I'll give you an example of a woman named Anne who we worked with who was very stressed out about not being able to practice postpartum confinement. She was very stressed out because she had lost her job at the beginning of the pandemic. And she was really worried that she didn't know how to take care of a newborn. She had this new life coming in and she didn't know what to do. And imagine a society where we actually supported Anne from pregnancy all the way through life. And that's what our program aims to do, is, you know, to have programs that have workshops where we teach families and women how to bathe their babies, how to breastfeed and mix formula if that's what they choose to do. Giving them the informational support that this community is asking for. That was one of the main types of supports that the Chinese community has asked for, is informational support from experts. But we also mix that with some mindfulness relaxation, because we know that mindfulness is a practice that Chinese communities accept and do, and so we want to encourage that. And then we have texting programs with information at every stage of child development to give parents the knowledge that they need and some activities that they can do with their child to help their child develop at that stage. And we do this on WeChat in the Chinese community because that's the platform that most people in the Chinese community use to communicate with their family at home. So we wouldn't know any of this if we didn't ask, if we didn't talk to the community and find out what is it in this community that makes sense. Because that's very different than the Latinx community, where women tell us that they're lonely, they're missing their family, and they're in need of more emotional support and peer support. And so support programs and support models in that community work really well, but that's not necessarily the case in every community. So, you know, I would just say that getting out there and asking the community what their strengths are, what their stressors are, what their desires are, is really critical, because it's not a one-size-fits-all situation.
So interesting, because I can imagine that no matter how well-intentioned, an overwhelmed pediatric practice is not necessarily going to know the specifics of what each culture requires or needs. Okay, question for you, Dana. Why does this matter? Which is to say, is there something about our lack of, you know, our failure to have these systems that nurture parents? Is there something about it that actually has tangible consequences for a child? Or another way of asking that might be to say, does poverty and neglect sort of affect brain development? You know, I mean,
Yeah.
what do we see here?
Yeah, and much of the work that I do, and I know that Bonnie does, is undergirded by the fact that the first years of life, the first 3 years of life, are so critical for foundational brain development. I think before you can understand the impacts of poverty, just understanding that those first 3 years of life, 85% of the physical brain is grown. 1 million new neural connections are being formed every second. And it impacts not just children's school readiness, right, but their academic trajectories, employment. I mean, so many of the issues that we see today later on life, the issues of, you know, hypertension, heart disease, type 2 diabetes, can actually be traced back to the early years. And yet this foundational time period it's great opportunity, right? It's why we are the smartest, most creative of all species. I mean, those first 3 years of life are the reason. But with great opportunity comes great risk, right? And I think Joan Luby, a researcher at WashU who I adore, talks about the fact that poverty's most insidious impact is on the developing brain. You can't see it, right? All these little kids look cute and cuddly, but because of all these neural connections being formed, you don't see the impact of poverty, which researchers like Kim Noble and Farah have really shown impact the very brain structure of individuals. Obviously, there's huge variation, and you can't say it always is, but it impacts the parts of the brain that are so critical for education. It impacts, I'll tell you some neuroscience, prefrontal cortex, the temporal lobe, amygdala and hippocampus, issues of, you know, self-regulation, cognitive development, memory and emotion. And all of those things are critical for school readiness. We know that in this country, more than 50% of kids aren't school ready in one domain. It impacts, life trajectories, and yet we have a country where, as I mentioned, a huge swath of our population are living in poor families. Children 0 to 5 are the poorest segment of our population. So I guess long and short of it, the early years are critical for brain development, and how we support and nurture parents as their children's brain architects is critical for allowing children to reach the promise of their promise.
Okay, so at the risk of sounding a bit like a broken record, again, I'm going to ask, I'll ask Bonnie, I mean, how is this manifesting in the population you see? I mean, talk to me about that.
So I think it manifests itself in much of the same ways that Dana's talking about, and the sad reality is that it's preventable. If we in our country, we tend to wait until bad things happen, and then we blame the people to whom they happen when we haven't been supporting them all along and giving them, a safe environment in which to succeed. And I mean, it's sort of crazy to think about that, that we wait until there's a crisis, and we do this if the concept of providing an environment that makes it easy for people to parent is something that we don't do, and we don't do it because we're not valuing families in the way we need to value families. In other public health domains, we do this all the time. We have huge campaigns of getting every child immunized, and insurance pays for it. Even public insurance pays for immunization because we don't want children to be contracting communicable diseases, right? But for preventive supportive services, behavioral health, the types of services that we're talking about, in most states, public insurance doesn't pay for it. They don't pay for services until you have a diagnosis, right? And that's when we treat you. We don't support you along the way to try to prevent that from happening. Think of seatbelt laws. We have, cars are built with seatbelts in them. We don't ask each family to go put a seatbelt in their car. No, we don't want people to be catapulted out of their car, so we make sure every car has a seatbelt in it. But we don't do that same thing with parenting and with support.
We Zoomed beforehand just to get to know each other a little bit, and something I wanted to say that both of you individually said, you're reminding me, is that there's such a stigma to ask for these things. And what if they were just automatic, if they just happened? Rather than demand, there's a big difference between things automatically being given to you and you showing up and asking for what should be yours, right? What seems like it should be something we all are entitled to. Now, I'm going to ask what is, I'm sure, a tiresome and cliched question, but has to be done, the COVID part, which is all of these problems obviously existed before COVID, but I want to know how COVID affected the families that you were working with. You can go for it.
You want me to?
Yeah, go.
Okay. Was that me?
It was a mic drop, literally.
All right, so I'll start. So most of these issues were true before the pandemic. I want to be really clear about that. And we didn't have structures in place before the pandemic, which is why when the pandemic hit, so many of them were exacerbated. Yeah. And I want to be clear, something that I haven't mentioned yet, this is an equity issue, and most of these challenges are even worse in communities of color and communities that have been disenfranchised over the course of years and years and years of structural racism and policy that we have in our country. And so if you think of, and give you an example of a woman in Sunset Park, her name is Maria, and Maria had a job in a store, and her husband was a janitor in the hospital. Prior to COVID hitting, they lived in a small, cramped apartment, in a basement apartment, with 3 children and Maria's mother, who lived with them. And they were just making ends meet, right? Like it was tough, and they were always on the verge of possibly being evicted or possibly not being able to put food on the table, but they were making it work. And then the pandemic hits. Maria loses her job. Her husband continued his job, but of course he was in a very high-risk setting. They had to go to work, was an essential worker as a janitor in the hospital. They were completely stressed out about him bringing COVID home, especially to her mother, who was older. Her children, her oldest was in 2nd grade, and her child was learning remotely. She was given a laptop or an iPad by the school, but it didn't work very well. It had to be updated often, and they lived in this basement apartment with concrete walls, so the Wi-Fi was really hard to use. And Maria couldn't help her with the technology. Maria couldn't help her with her schoolwork because Maria doesn't speak English. And the child kept her camera off the whole time because she was embarrassed by her living surroundings. So very barely engaged in what she was doing. So imagine for a moment that we had structures in place ahead of this, ahead of the pandemic, that would have made life a little bit easier. It would have taken off some of the stressors. Imagine we had a minimum living wage to make sure everybody could put food on the table. Imagine we had affordable housing where people could live in a space that was appropriate for them. Imagine we had universal broadband so everybody could connect and access the healthcare, education, and social supports that they needed. Things would have looked really different when the pandemic did hit, when any crisis hit.
It never occurred to me until you said this, that some students might have kept their cameras off simply out of shame. They just didn't want others to see what their homes looked like. Did you encounter that a lot, just out of curiosity?
Yeah, that happened a lot. And we hear from teachers that when teachers did see what was where children lived, that was really hard for them. So teachers were going through their own emotional turmoil during this because of what their own families were going through, but also living through the eyes of the children that they teach, that it gave them an eye into their homes that they never had before.
And of course, that makes the assumption that their houses are wired for broadband to begin with, for internet learning. Dana, you have a part in your book that I was transfixed by. I thought I knew a lot about the history of childhood in the United States. This was a big lacuna in my knowledge. I did not know this. You go off on this really beguiling disquisition about how we became transfixed with K through 12 as the time to invest in, such as it is. It's still anemic, but comparatively speaking, can you just, I know this is strange, but can you just give everybody a brief overview of how it is that we became so obsessively focused, almost fetishistically focused on K through 12, and thought that 0 through 4 didn't matter?
Yeah.
I
I feel honored that I shared something new with you. She knows everything.
No, I don't, but anyway.
So the K-12 system is, we've always looked at it as the great equalizer. At some point, giving all children access to the American dream. And so, when things haven't worked out, we've doubled down, and I'm all about K-12, so this is not a knock on K-12, but we know that, learning doesn't begin on the first day of school, but the first day of life. And I was like, why is it that? Why is it this way? And I'll tell you the history, but I want to start off with a joke.
Oh.
Because I'm like, So there's a policeman who comes upon this gentleman who is on the ground, searching for something under this big street light. And he says to the guy, what are you looking for? And he goes, I lost my keys. So the cop starts kneeling down to help out the guy. And he goes, where'd you lose this? And he goes, across the street. And the cop goes, why are you looking here? He was like, well, the light's better here. All right, so I'm not a comedian, I'm a surgeon. I'm really trying. But this is emblematic of what we call the streetlight effect, I know. I really did try to, my husband said it was gonna fall flat, and he was right. But
you're so funny now, it doesn't matter.
But the streetlight effect is really emblematic of, I think, our focus on the K-12. We look where the looking is good. This is where kids are. We want to give them the chance. Let's double down, which is important and admirable. But learning doesn't start on the first day of school. It starts on the first day of life. And so why are we in this moment historically? And it's super interesting. I love history. And the truth is that you can trace back our K-12 system back to a 17th century minister, actually in the Czech Republic, Comenius, who actually laid out what looks remarkably similar to what we have today in the U.S. He was really quite the innovator, and it was for religious reasons, right? It was so that people could read the Bible and follow the Bible. And, you know, this information went all the way across the pond to the Puritans and, you know, who were setting up colonial America. And, you know, it went 17th century viral. And it actually started laying down what, you know, the K-12 system looks like in this moment in time. And there was one issue. He believed strongly that, you know, the early years shouldn't be part of the system. It was very much in the domain of mothers, which, you know, we can talk about that, but, you know, never the twain shall meet, you know, and so it is why we look this way. On the positive side, because we were the first to institute free, you know, universal public education, it is why, I don't mean to sound national, it's why we did so incredibly well in the 20th century. Right. The only issue is the rest of the world sort of realized it, they caught up, and then they leapfrogged us, beyond us, and every other country supports the early years because they realize, oh gosh, if we want them to be on the trajectories that we want them to be, you've got to start early. Anyway, so the streetlight effect is why I think that we've sort of, one reason that we've sort of pushed the early years and parents and caregivers to the side, so.
Okay, so now I'm stuck on that phrase, the domain of mothers. This is a question I've wanted to ask both of you, and given the framing of our discussion, I don't want anybody to think here that what I'm doing is blaming parents here, but every parent in this audience, at some point, if not every single day with metronomic regularity, wakes up and thinks, I'm doing this wrong. They think, I'm not doing this right. And I am wondering what kind of biases your parents, each of the parents that you've been dealing with, are encumbered by, the misconceptions that they kind of carry with them about how they should be parenting. Bonnie, I bet they're really interesting in your community. I'm just going to guess.
Yeah, so, you know, we scrutinize parents terribly, and all parents, I believe, want what's best for their child, right? I mean, that is the definition of a parent. But yet, the amount that we scrutinize parents, especially parents of color and parents from communities that are from other cultures, is extraordinary. And the white American way of doing things is not always the right way of doing things for every parent and for every community. So I'll give you an example of you know, immigrant parents who don't speak English or don't speak English very well. And we have parents in our community who are very stressed out about not being able to speak English to their children, not being able to prepare their children for school. What's going to happen when my child enters school and doesn't speak English? So they try to speak as much English as they can with their child to get them ready. When the research shows that what we really should be doing is speaking with our children in languages that we're comfortable in, that we're fluent in, because it's the complex sentences and the complex thoughts that happen when you're fluent in a language that actually helps the brain develop and helps the child learn and helps the child be prepared to learn in school in whatever language. And so there are misconceptions that parents sometimes have because of all the pressures and the scrutiny that they're getting from the rest of our society, rather than you know, being able to just be who they are and be who they are with their children, which is really the most important.
So any language, any
language, whatever language.
Something that's foundational that can help kids learn to think in abstracts and things like that. Mm-hmm. But the pressures of living in an immigrant community where you want to assimilate, you don't want to stand out to ICE or whatever, right. I can imagine. You must also have stories about that. Tell me.
Yeah, and I'd like to even broaden it. I think it really traces back to this idea of American individualism, right? That you have to be tough and independent and go it alone. And it's seeped into this idea of parenting, right? And we have sort of internalized this propaganda that parenting is a go it alone scenario. Now, let me be clear, you know, only parents and caregivers raise their children, but that expecting or any type of support is seen as a form of weakness. And so, you know, this feeling of shame and, you know, when one of the mothers that I interviewed, who's actually a PhD at the University of Chicago, who had to give up a promising postdoctoral career because she couldn't afford childcare, said, you know, Talia said, you know, I felt like I was failing in all parts of my life. And when you see, when you view parenting and raising the next generation akin to like buying a puppy, it's all on you without societal value, you start internalizing it and you have zero expectation for societal support and you don't see this larger collective identity. And so I think that this is one of the core issues, is not our country not seeing the value of the labor and love that goes into raising the next generation as key to our societal support. It's not only important for the individual, but our society, and that's where we're such outliers. So that was a long-winded way of saying, yeah, it's.
But also that we've internalized this sense of unentitlement. I mean, that's what's amazing to me. Yeah.
Can I add something to that?
Please.
Because you reminded me of something I meant to talk about earlier, which is that in many communities, in particular in immigrant communities, there is that tight-knit support of each other, right? In a way that is truly not an American thing. So I'm thinking of, people in the community who take care of each other's children, and they often don't get paid for it, but the aunt or the neighbor who takes care of your child, and we call them family, friend, and neighbor caregivers, right, or FFNs. And we have all of these pressures coming from policymakers and other folks in the community saying, you need to put your child in a daycare. You need to put your child in a pre-K, in a 3K, in a 4K, because that's how your child's going to be ready for kindergarten. Well, in many cultures, that's not what people want. And that's we're trying to fit like a square peg into a round hole, right? Like we're trying to make people do things that are not true to them. And what we try to do is support these family, friend and neighbor caregivers and develop networks of caregivers and give them the training and the support that they need, that they ask for, so that they can do the best jobs that they can do. Rather than trying to have this individual, like, no, you need to send your child there, you need to send your child there. But build on the strengths in the community that are supporting each other.
And from the point of view of neuroscience, would I be right in assuming that that would be every bit as healthy for a young child as putting them in a pre-K?
Yeah, absolutely. It's, as you say, it's about supporting that. Look, in the early years, it's not that complex.
Right.
What do children need? They need rich, nurturing interaction and protection from toxic stress, right? It's not rocket science.
Right.
And the truth is that friends, family, neighbor, if supported in the right way, are just as effective, in providing that. But yeah.
But they need the support.
But they need the support. All right, so I've got an eye on the clock. There are 3 things I want to get to. So,
oh, goodness.
Okay, this is the lightning round where I just need to get this in, and then we're going to have you had this one part in your book about the child care bill that almost was. And it's an amazing little snippet of a recent American history. We almost passed a comprehensive child care bill. Go.
Sliding door moment. Gwyneth Paltrow, do you go left or right?
Exactly.
This moment in time, on Nixon's desk was a bill that would have provided universal high-quality child care universally, right? It was on a sliding scale, and even parents who stayed home would have gotten support. It had tremendous bipartisan support from the left and the right. People said it would have been as transformative as Medicare would have been for the elderly. At the 11th hour, Nixon had both a speech saying, we passed it, and a speech that said, I vetoed it. He chose the one that said, I vetoed it, because Pat Buchanan convinced him that he would be akin to the Soviet Union that had high-quality child care. He nixed it, and not only nixed it, he drove a stake through its heart. And you see this patchwork of non-system of support across the country, because he said it would weaken families. I wouldn't have had to write the book. You wouldn't have written All Joy, No Fun. It would have been we wouldn't be here. So yes, it would have been a different moment.
It would have been a different world. And just I just want you to point out, this was not shallow bipartisan support. This was deep bipartisan. And of course, it was at a time when there were liberal Republicans and conservative Democrats.
Nixon ran on early child care. Early child care.
And also, universal health care. He proposed it in a State of the Union. Nixon is a whole other interesting conversation about how far to the left of everyone he'd be today. But yes, anyway, but it had, what, 63 votes in the Senate? It was something preposterous. I mean, it was filibuster, it was everything, and across the aisle. Okay, anyway, so final question, now that we're in this world, not that one, unless we find some wormhole in space to crawl through. What's the art of the possible here? What can we do? What can we actually do, given where we are? Let's start with Bonnie.
So, I thought you wanted to start this one. No? I'll start. So I don't believe that we can talk about turning the corner and developing policies and programs that support families without talking about structural and individual racism. If you look at policies in the past that have been brought to the table to support families, often what happens, and we look at welfare reform in the 1980s and 90s, often what people talk about, the picture that people put up is a woman of color. In welfare reform, it was a welfare queen, a black woman who was cheating the system, right? That was the image that people thought about, and that is what drew so much of the pushback against policies that support families. And so if we do care about families and we really want to support families, we need to come to terms with that. And over the past couple of years, I feel like we're in a new chapter of starting to think about how to address the historic and current policies that have brought us to where we are right now, but we have a lot more work to do in that. And I really do believe that if we don't take that on, we're never going to get to a point of true support.
And I'll add to that. So I always look for bright spots for hope. Back half a century ago, the poorest, most underserved population in this country were not children as it is today, right? Children are the poorest. It was the elderly. And through bringing their collective voice across demographics, education, religion, et cetera, and the AARP, they changed what it is to be elderly in this country. 70% fall in poverty rates. They're viewed, as they should be, as important contributors to our society. I think that parents, caregivers, anyone who cares about children and the future of our country, through a similar sort of structure, could push forward. I don't know, we can call it NAPC, National Associations of Parents and Caregivers, whatever. And,
right.
And it could be, and with real partnership with corporate America, believe it or not, they are suffering as well. And it is not just, I think that's about the only way we're going to shift it. Because most people actually don't believe that 1 in 4 moms should go back to work after 2 weeks. Most people believe that all parents want the best for their children, which is the fact. So
it's so brilliant, and it's such an imaginative idea, but it is so demoralizing to think that the best solution might be form a powerful lobbying organization, right? Isn't that sort of what you're saying?
let me tell you, the AARP is literally the only consumer lobbying organization out there. They spent $300 million in the last 20 years advocating for an age demographic. I mean, the rest is, healthcare, big pharma, et cetera.
Yeah.
I mean, I'm a physician, so I guess. So, look, it's, you bring voices together and you get the support that you need. The fact that we have no paid family and medical leave, like, seriously, that's like a gimme. So, at least in my opinion.
I agree. So, questions from the audience? All right, yes, lots of hands. Oh, this is exciting. Good. Am I supposed to pick and then you hand out? Oh, that's how this goes. All right. I believe this lovely woman in the front was the first to do
that. I really commend what you're doing. I work in the same arena in education on a national level. And the racial divide is getting worse for children of color. Something that I want to bring to your attention is a great deal of failure comes because they come to kindergarten knowing 6 letters and 2 sounds. So they're already starting behind because the educational system has a curriculum and they want them to be writing paragraphs at the end of kindergarten. So it is a serious issue, which my cause is the crisis in early literacy. When I established the Institute for Literacy years ago, 80% of American children read on grade level. Today, 30%. And if you can't read, and it gets insidious from grade to grade, it's a whole psycho-emotional and a burden on society and their life, which is far more costly. So I hope you'll add to your, and I work in schools in your area in New York. I hope you'll add to having some component of teacher training for those 3 and 4 and 5-year-olds. Very important, because the teachers today aren't trained, and it's important.
Thank you for your comment. Can I respond to that? So I believe that, and I think the research really supports this, that we ask too much of our kindergarteners. We shouldn't be asking kindergarteners to be writing paragraphs by the end of the year. And we shouldn't be asking kindergarteners to show up to kindergarten knowing letters and numbers and I mean, there's, to the extent that one would need to be able to be writing paragraphs by the end of the year. The research really shows that the most important thing to come to school with is the social and emotional development to be ready to learn, not to already have started that learning. And so I think there is a disconnect between what's happening in kindergarten and what's happening in high quality childcare that actually promotes that kind of social and emotional well-being. And that is something that we've seen a lot of people showing up to kindergarten with different expectations than the expectations that their preschool teachers had. That's right. Totally agree. Totally agree. Yeah.
I'm trying to. Okay, let's do over here.
Hi. I want to apologize in advance for being the bearer of bad news and asking an impossible question. But while we were talking here today, the Supreme Court overturned Roe v. Wade, and I'm thinking about these states where abortion is likely to be quickly overturned or unavailable, and those are the same states that have the lowest per capita per student spending, the greatest impoverishment in this country. So what do we do for those parents who are going to be thrust into parenthood without any other option?
That's a terrific question.
Do you want to start?
I mean, I think we keep doing what we're doing and doubling down. I mean, I think going back to the last point of hope, I mean, unless we bring a collective voice to get the supports that families need in the early years, I mean, it's going to be even more difficult. And we know that COVID, the children born during the time of COVID have had, an impact on their developmental milestones because of the stress related to the parents dealing with the pandemic. So I guess I don't have a great answer other than to say this is an even a greater reason and a greater call to action. So.
Yeah, I mean, I wish I had an answer, but I think it is just yet another reason why having policies and structures in place to support families is so critical. I mean, we can talk about, rights to abortion and ways to deal with that, but if families and parents are going to be having children who they are not prepared and not able to care for, they're going to need even more supports than we're talking about right now on the stage. And so it is just, it heightens the importance of having structural environmental changes and policies in place to make it easier for parents to parent because it's just too hard.
Look, I mean, look, we have the scientific case. If I didn't do one more randomized control trial, Monty didn't do one more randomized control trial, we know what children need in the early years. We understand the supports that parents need. We have an economic case. I mean, $13 billion a year are lost by corporate America because we don't have high quality childcare. We've got the case. What we don't have is the public or political will to push these things forward. And we can keep talking, but unless that happens, I feel like 50 years from now, we'll talk about another sliding door moment. So.
Right. both of you had your hands up early, I saw. Yeah, okay, you and then maybe finally, yes.
Thank you. I really appreciated everything you all said. I work at a nonprofit and another nonprofit that focused on ECE. And I come from immigrant parents, and I have these practices where my mom and maybe me in the future one day, for 40 days, the mom is completely isolated. We can't read, we can't look at TV, we are just like with the baby, and I really want to hold that close because it's my culture. How do we get jobs and the workforce to instill these kinds of policies where there's equity across the table for these communities that practice these type of things? Do we need to start at the local level, like the state, the federal? Like, how do we implement these practices that we follow? Because my plan is not to go back to work after 2 weeks. I want to stay with my future child for 40 days, possibly more. So how do we do this? What is a good idea? I know lobbying and storytelling sometimes works, but I feel like right now with the way political climates are, it's really hard to pass equitable things like that.
40 whole days.
Yeah.
That's what we're yearning for. That's our gold standard. But anyway, I just have to note that that's your dream. I mean, that's the bare minimum in so many other places. Anyway, go on.
Yeah, I really appreciate your question. Thank you for asking and for sharing that with us. I think it starts on the local level, because to me, you can't, a policymaker sitting behind a desk cannot make these decisions for people, right? And people need to be in the community understanding what different cultures need, what different cultures' histories tell us. And equity means everybody getting what they need at the right time. It doesn't mean everything's the same for everybody. And so understanding that and understanding the differences and understanding what needs to happen in order to help people be the best parents and have the happiest life that they can is really important, and no one's going to know that if they're not out in the community understanding that. And from that, build up. Because if you go, the way I see it, if you go to policymakers on the national level and try to explain this, it will go in one ear and out the other. People need to experience it. They need to meet people. They need to actually understand what it's like to live in community. And I don't think the people making these decisions have that understanding.
And I'd just like to add one little other thing. You know, in my discussions after the book, I've been really heartened to hear actually the business community, maybe it's an echo chamber of businesses, really hearing what families need. Maybe it's pragmatic because they need people, they want women to come back to work. But, while I believe strongly that there needs to be a federal paid family and medical leave, in the interim, I really think that the right businesses can be partners in what needs to happen, at least in some of the discussions. There's a group called Best Places for Working Parents that are really trying to push forward businesses to sort of embrace this concept. So,
Do we have time for one more? I did promise this gentleman.
Thank you, and also thank you for clarifying the point about we do know what works already. I wonder, at the risk of taking us into a giant, big rat hole, if you could speak briefly about what the best thinking and possible examples are of the infrastructure that might do this, because our big urban public school districts don't deliver today for Black and in many places brown students. I mean, the people that the policy solutions are aimed at, and you could say the same thing about our healthcare infrastructure.
I love this question.
So, great. It's probably
Right.
a separate panel, but that's the question.
No, actually, I think about this a lot because to really scale effectively, the reason we keep looking at K-12 is their school systems. That's where kids are. The one bright spot is actually the healthcare system. In the first 3 years of life, there are, I think, oh gosh, now I'm Blanking.
7, I think 7 or 9 visits in the
it's even
first year.
more
In the
than
first
that.
year.
In the first year,
it's 7, I think.
number of visits to the pediatricians and leveraging the healthcare system and not putting it all on the pediatrician because they're already sort of overburdened, but there's some really cool models out there leveraging that infrastructure, Healthy Steps, Reach Out and Read, Family Connects or Chicago Connects, that really uses that as an infrastructure to, in a public health way, allow parents to get what they need. Because some parents only need just a little bit. Talk and nurture your baby and you're great. Some families need to be connected because of homelessness or food insecurity. But you can use that, I think, as a powerful infrastructure for the educational continuum that needs to happen from day one.
And can I just...
Yeah, and navigation, exactly. Yeah.
And can I just add one thing to that? In order for that to work, we need to fund it. We need public insurance to be able to pay for it so that, that the providers in the healthcare system can bill for it, because that's the only way that this is going to be systematized and be, really, truly throughout the entire population. And I would also add that in the first 3 years of life, there are community groups and there are community assets that we could be tapping into. There are women in the community who are helping out other women when they're pregnant. There are, as we said before, these family, friend, and neighbor caregivers who are taking care of children. There are a lot of inlets into the community. We just need to look for them because we're not right now. We're relying on the K through 12.
You've been terrific. You've been terrific. My goodness. Thank you, everyone. Thank you.